Heat-related illnesses are significant medical emergencies, especially during warmer months or prolonged physical activity. As EMS providers, understanding the spectrum of heat illnesses helps save lives, whether it's preventing mild conditions from worsening or recognizing life-threatening emergencies like heat stroke. Moreover, we must also stay vigilant about our own risk when working under extreme conditions with PPE or during extended incidents. Heat illnesses are common in EMS responses, especially during the summer months or in high-activity environments where heat exposure is unavoidable. Whether responding to outdoor events, working fires, mass casualty incidents, or long-term rescue operations, EMS providers frequently encounter patients suffering from heat cramps, heat exhaustion, or heat stroke. These emergencies are not only frequent but can escalate quickly if not identified and managed appropriately. Understanding environmental risks and patient vulnerability is crucial for maintaining operational readiness and delivering effective patient care. Early recognition and treatment are essential in preventing severe outcomes. When EMS providers are able to identify heat illnesses during the early stages, such as with complaints of dizziness, weakness, nausea, or profuse sweating, intervention can begin before the condition progresses to a more critical state. Simple steps like moving the patient to a cooler environment, initiating hydration, and starting active cooling can dramatically improve patient survival rates and prevent long-term complications. Failure to recognize and act swiftly increases the likelihood of multisystem organ failure or even death in severe heat stroke cases. It is equally important to remember that EMS providers themselves are at risk. Long hours in PPE, physical exertion, and limited access to hydration place responders in a vulnerable position. Providers must recognize the signs of heat illness not just in their patients, but in themselves and their partners. Knowing the early signs, practicing preventive measures, and understanding immediate treatment protocols help ensure that both responders and patients stay safe during high-heat operations. Heat-related illnesses exist on a continuum, starting with heat cramps, progressing to heat exhaustion, and culminating in the life-threatening condition known as heat stroke. Recognizing these stages is critical for EMS providers to intervene early and prevent serious outcomes. Heat cramps are often the first indication that the body is struggling to maintain its temperature. These painful muscle spasms, typically occurring in the legs or abdomen, result from heavy sweating and electrolyte loss during intense physical activity. While not immediately dangerous, heat cramps signal the need for rest, hydration with electrolyte solutions, and cooling measures to prevent progression. If heat cramps are ignored, patients may develop heat exhaustion, a more serious condition where the body's cooling systems are still functioning but are overwhelmed. Patients experiencing heat exhaustion may present with heavy sweating, weakness, dizziness, nausea, vomiting, and headache. Without prompt treatment, such as removing the patient from the heat, initiating active cooling, and providing oral rehydration, heat exhaustion can advance to a critical stage. Heat stroke represents the failure of the body's temperature regulation systems and is a true medical emergency. Core body temperatures can rise rapidly above 104 degrees Fahrenheit 40 degrees Celsius, causing altered mental status, hot and dry skin, seizures, and multi-organ failure. Heat stroke requires immediate, aggressive cooling and rapid transport to a hospital. EMS providers must be able to recognize the subtle transition from one stage to the next, act quickly to intervene, and educate patients about the importance of early symptom recognition to prevent severe heat illness. Heat cramps are an early warning sign of heat-related illness and are commonly seen in EMS responses during hot conditions. They present as painful muscle spasms, usually affecting large muscle groups such as the legs, thighs, or abdominal muscles. These cramps often occur after intense physical activity when heavy sweating leads to significant loss of electrolytes like sodium and potassium, disrupting normal muscle function. Heavy sweating is a key contributor to heat cramps. While sweating helps cool the body, it also depletes vital salts. If those electrolytes are not replaced, muscles can become irritable and cramp painfully. Along with cramping, patients often report thirst and fatigue, signaling early dehydration. These symptoms may seem minor but can progress quickly if not addressed. Initial management focuses on stopping activity, moving the patient to a cooler environment, and beginning oral rehydration with fluids that contain electrolytes, like a sports drink. Gentle stretching and massage of the affected muscles can also help relieve spasms. If symptoms persist or worsen, transport to an emergency facility may be necessary for advanced care. Prevention strategies include encouraging regular hydration with electrolyte-containing fluids during exertion in hot environments. EMS providers must also be aware of their own risks while working in high heat conditions. Recognizing and treating heat cramps early not only prevents escalation to heat exhaustion or heat stroke but also protects the overall well-being of both patients and responders. The treatment for heat cramps focuses on removing the patient from the hot environment and beginning supportive care immediately. The first priority is to move the patient to a cool, shaded, or air-conditioned area to stop ongoing heat exposure. By reducing the external temperature, the body can begin to recover from the physiological stress caused by overheating. Once in a cooler environment, it is critical to encourage oral hydration with fluids containing electrolytes. Water alone may not adequately replace the sodium and potassium lost through excessive sweating. Electrolyte-containing beverages, such as sports drinks, are ideal for restoring balance and preventing the progression to more serious conditions like heat exhaustion. If a commercial electrolyte solution is unavailable, a mixture of water with a small amount of salt and sugar may be used in some cases. In addition to cooling and hydration, gentle stretching and massage of the affected muscle groups can provide symptomatic relief from the painful spasms. Stretching helps relieve tightness and restores normal muscle function, while massage increases local blood flow and may speed recovery. EMS providers should continue to monitor the patient closely after initial treatment to ensure symptoms are improving. If cramps persist, or if there are signs of confusion, vomiting, or worsening fatigue, transport to a medical facility should be considered for further evaluation. Early, simple interventions can significantly reduce the severity of heat-related illnesses and improve patient outcomes in the field. Heat exhaustion is a serious condition that results from prolonged exposure to high temperatures, often coupled with inadequate hydration. One of the most notable early signs of heat exhaustion is profuse sweating. Sweating is the body's natural method for cooling itself, but when fluid and electrolyte losses become excessive, the body's ability to regulate temperature weakens, leading to worsening symptoms. As dehydration progresses, patients commonly experience weakness and dizziness. These symptoms are caused by a drop in blood volume, leading to decreased perfusion to vital organs, including the brain. Patients may feel lightheaded, unstable on their feet, or even close to fainting. Without prompt intervention, these symptoms can escalate and place the patient at risk for heat stroke. Another hallmark symptom of heat exhaustion is nausea and vomiting. As core body temperature rises and dehydration worsens, gastrointestinal distress is common. Vomiting further exacerbates fluid and electrolyte losses, creating a dangerous cycle that can accelerate the patient's decline if not addressed quickly. Headache is another frequent complaint, often resulting from dehydration and electrolyte imbalance. The headache may be mild at first but can become severe as the body struggles to maintain normal function. Recognizing these early warning signs allows EMS providers to intervene before the condition progresses to life-threatening heat stroke. Rapid cooling, oral rehydration if tolerated, and early transport are critical components of treatment to ensure patient recovery. The treatment of heat exhaustion focuses on reducing the patient's core temperature and restoring hydration. The first and most critical step is to remove the patient from the heat. Moving the patient into a shaded, air-conditioned, or otherwise cooler environment halts ongoing heat gain and provides a safe space for further treatment. Even simple actions like placing the patient in a shaded ambulance or under a tent can make a major difference. Once out of the hot environment, active cooling measures should begin immediately. This includes the use of fans to promote evaporative cooling and applying ice packs to key vascular areas such as the axillae, armpits, groin, and neck, where major blood vessels are located. These methods can help lower core temperature gradually and safely, improving patient outcomes before transport is even initiated. In some cases, misting the skin with cool water while fanning can also greatly enhance cooling efficiency. If the patient is awake, alert, and able to swallow safely, oral rehydration should be encouraged. Fluids containing electrolytes are preferable to plain water, as electrolyte losses are a major contributor to heat illness. Small, frequent sips of a sports drink or rehydration solution can help restore balance and speed recovery. Monitoring the patient's airway, breathing, circulation, and mental status remains a priority during treatment. If symptoms worsen or the patient shows signs of confusion, vomiting, or inability to protect their airway, rapid transport and ALS interventions may be necessary. Heat stroke is a true medical emergency that demands immediate recognition and aggressive treatment. It occurs when the body's internal cooling mechanisms, primarily sweating and vasodilation, fail under extreme heat stress. Once these systems collapse, the body's core temperature can rise rapidly, often exceeding 104 degrees Fahrenheit 40 degrees Celsius, leading to severe cellular and organ damage. One of the hallmark signs of heat stroke is an altered mental status. Patients may appear confused, agitated, disoriented, or unconscious. Seizures may also occur as brain function deteriorates under the high internal temperatures. Mental status changes are often the first and most critical sign for EMS providers to recognize, even before full assessment. Hot, dry skin is another key indicator. While early stages of heat illness often involve heavy sweating, in true heat stroke, the patient may present with hot, flushed skin that feels dry due to the complete failure of the body's evaporative cooling mechanism. However, some exertional heat stroke patients may still be sweating, so skin condition alone cannot rule it out. A rapid pulse typically accompanies heat stroke, reflecting the body's attempt to maintain blood pressure despite severe dehydration and vascular collapse. Tachycardia, along with hypotension, is a dangerous sign that the cardiovascular system is failing. Left untreated, heat stroke can cause seizures, organ failure, and death. Immediate, aggressive cooling and rapid transport are critical. EMS providers must act quickly. Recognizing altered mental status in a hot environment should always trigger a high suspicion for heat stroke. The treatment of heat stroke begins with immediate and aggressive cooling. Time is critical, and every moment that core body temperature remains elevated increases the risk of permanent neurological damage or death. Cooling measures should start at the scene without delay. The most effective method includes evaporative cooling, spraying the patient with cool water while using fans to promote evaporation. Additionally, placing ice packs on major vascular areas such as the neck, armpits, and groin can help lower core temperature rapidly. Full body immersion in cold water, if available and safe, is another highly effective option in some settings. At the same time, rapid transport to an advanced medical facility must be initiated. Cooling efforts must continue en route and should never delay transport. The goal is to continue active cooling while moving toward definitive care where advanced supportive measures, laboratory testing, and intensive monitoring can be performed. EMS crews should alert the receiving facility early, providing a heat stroke alert if possible, to prepare for advanced interventions like airway management, aggressive cooling, and potential critical care needs. Airway management becomes crucial if the patient's mental status deteriorates. Many heat stroke patients experience seizures, vomiting, or decreased consciousness, putting them at high risk for airway obstruction and aspiration. Providers must be prepared to suction as needed, insert advanced airways, and ventilate if respiratory status worsens. Treating heat stroke requires urgency, teamwork, and a focus on both rapid intervention and patient safety throughout transport. Accurate and timely assessment is critical when evaluating a patient for possible heat-related illnesses. If available, obtaining temperature readings can provide valuable confirmation of heat stress, particularly in patients suspected of heat stroke. However, a lack of temperature monitoring tools should not delay treatment if clinical signs strongly suggest heat illness. Monitoring mental status is equally important. Early confusion, irritability, or altered responsiveness often indicates central nervous system involvement and a worsening condition. A declining mental state is a strong red flag for heat stroke and demands immediate action. Along with neurological checks, vital signs should be closely monitored. Tachycardia and hypotension are common findings due to dehydration and cardiovascular strain. Assessment of skin signs offers important clues as well. Patients with hot, dry skin are at a higher risk for heat stroke, while those with heavy sweating are often earlier in the progression of heat illness, such as heat exhaustion. It's essential to remember that exertional heat stroke patients may still be sweating heavily, so skin moisture alone cannot rule out severity. Lastly, obtaining a focused history provides context for the patient's condition. Important information includes recent exertion, duration of heat exposure, adequacy of hydration, clothing or gear worn, and the characteristics of the working environment. Heavy, non-breathable clothing, poor ventilation, and direct sun exposure all significantly increase risk. A thorough, focused assessment not only directs appropriate treatment but also helps prevent underestimating the seriousness of the patient's heat-related illness. Protecting EMS providers during hot weather operations is just as important as treating heat-affected patients. On long or high-intensity scenes, it is critical to hydrate regularly to maintain blood volume and effective thermoregulation. Providers should drink fluids consistently, not just when they feel thirsty, as thirst is a late indicator of dehydration. Electrolyte-containing beverages are preferable over plain water during prolonged exertion. Another key strategy is to rotate crews whenever possible. Prolonged exposure to high heat while wearing heavy gear significantly increases the risk of heat stress. By alternating personnel between active work and recovery periods in a shaded or air-conditioned area, crews can maintain operational effectiveness and reduce medical risks. Incident commanders and supervisors must be proactive in enforcing rest and rehab rotations, especially during large-scale incidents. Wearing lightweight, breathable clothing under gear also makes a significant difference. Moisture-wicking fabrics can help regulate body temperature and decrease the burden on the body's cooling systems. Providers should avoid unnecessary layering and ensure that PPE fits appropriately to maximize airflow without sacrificing safety. Finally, it is essential to monitor each other for early signs of heat stress. Symptoms like dizziness, confusion, nausea, or excessive fatigue must be recognized and acted upon immediately. Encouraging an environment where team members feel comfortable speaking up if they are overheated can prevent serious emergencies. A strong crew support culture keeps everyone safer and maintains the ability to serve the public effectively, even under extreme conditions. Certain populations are at significantly higher risk for developing heat-related illnesses, and EMS providers must maintain a heightened awareness when evaluating these individuals. Elderly patients are particularly vulnerable because the aging body often loses its ability to regulate temperature effectively. They may have reduced thirst perception, impaired sweating response, and may be taking medications such as diuretics or beta blockers that interfere with thermoregulation. As a result, heat illnesses in elderly patients can develop quickly and progress to life-threatening stages without clear early warning signs. Children are another high-risk group due to their smaller body size and underdeveloped temperature regulation systems. They absorb heat faster than adults and rely more heavily on surface cooling mechanisms like sweating. Children also may not recognize the symptoms of heat illness in themselves or may ignore them while playing or participating in outdoor activities, delaying needed care. Patients with chronic illnesses, such as diabetes, cardiovascular disease, or renal insufficiency, are also at increased risk. Their underlying conditions can impair the body's ability to compensate for fluid loss and temperature extremes. In addition, medications for chronic diseases can alter hydration status and electrolyte balance, further compounding their risk. Finally, outdoor workers and athletes are highly susceptible due to prolonged exposure to high temperatures combined with heavy physical exertion. Without adequate hydration breaks and environmental controls, these individuals are prone to rapid overheating. Recognizing these vulnerable groups allows EMS providers to prioritize early intervention and education to prevent serious outcomes. Certain populations are at significantly higher risk for developing heat-related illnesses, and EMS providers must maintain a heightened awareness when evaluating these individuals. Elderly patients are particularly vulnerable because the aging body often loses its ability to regulate temperature effectively. They may have reduced thirst perception, impaired sweating response, and may be taking medications such as diuretics or beta blockers that interfere with thermoregulation. As a result, heat illnesses in elderly patients can develop quickly and progress to life-threatening stages without clear early warning signs. Children are another high-risk group due to their smaller body size and underdeveloped temperature regulation systems. They absorb heat faster than adults and rely more heavily on surface cooling mechanisms like sweating. Children also may not recognize the symptoms of heat illness in themselves or may ignore them while playing or participating in outdoor activities, delaying needed care. Patients with chronic illnesses, such as diabetes, cardiovascular disease, or renal insufficiency, are also at increased risk. Their underlying conditions can impair the body's ability to compensate for fluid loss and temperature extremes. In addition, medications for chronic diseases can alter hydration status and electrolyte balance, further compounding their risk. Finally, outdoor workers and athletes are highly susceptible due to prolonged exposure to high temperatures combined with heavy physical exertion. Without adequate hydration breaks and environmental controls, these individuals are prone to rapid overheating. Recognizing these vulnerable groups allows EMS providers to prioritize early intervention and education to prevent serious outcomes. Heat illness can escalate quickly, often progressing from mild symptoms to life-threatening conditions within a short period of time. Early recognition is critical in preventing serious outcomes such as heat stroke, seizures, or death. EMS providers, athletic trainers, outdoor supervisors, and members of the public must remain vigilant, especially during hot weather events or prolonged physical exertion. Identifying early signs, such as dizziness, confusion, heavy sweating, or weakness, allows for fast intervention and a much greater chance of full recovery. It is essential to always treat suspected heat illness as a true emergency until proven otherwise. Even mild signs of heat stress should not be underestimated. Patients who present with altered mental status, hot and dry skin, vomiting, or fainting require aggressive cooling and rapid transport to definitive care. Waiting to see if symptoms improve can cost valuable time and worsen the patient's prognosis. EMS crews should always initiate cooling efforts in the field and coordinate early with receiving facilities to ensure seamless care. Above all, staying alert, staying hydrated, and staying safe are key principles for both EMS providers and the communities they serve. Hydration, proper scheduling of physical activities, regular rest breaks, and early recognition of symptoms should be part of everyday practice during hot conditions. By maintaining high situational awareness and promoting preventive strategies, EMS teams can help save lives, protect each other, and reduce the frequency of devastating heat-related emergencies. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your knowledge of the topic. And that you for visiting EasyEMS.com.